want to show you, just like I showed you, a tool that we think can be very helpful in coaching around the checklist. So the checklist coaching tool, which we spent a couple of calls talking about and which we really want you to use in your operating rooms. Now I want to show you and walk you through just a little bit a teamwork coaching tool. So I'm going to break out. When you answered the poll for me, you were actually answering for me some of the questions that are on the teamwork tool that we encourage you to use. And they're the same, they ask the same kinds of things, and when you answered the poll, one of the reasons for doing that was to show you that this kind of a tool is not that difficult for most of us who've worked in the operating room for a long time to get used to using. So I don't think it's terribly intimidating, and there's certainly not concepts that you don't already understand pretty well. So let me walk through that tool and show you where it touches on specifically some of the things that I've said I think are really important in teamwork in the operating room. Let's take closed loop communication, for example, and here you can see how the tool can kind of poke around that a little bit. Verbal communication among team members was easy to understand. Well, clearly, when the message is sent out, it needs to be able to be heard to be the first part of the loop. And then here, in the seventh question on the teamwork coaching tool, we ask it directly. Speakers made a visual or spoken effort to confirm that important information was received. So that is closed loop communication, and that teamwork tool then can help you look in your own ORs to see, are people doing this? So theoretically, you could take the little course that we want to teach you, take it back to your hospital, teach it to some people in the operating room, and then go in and see, using this tool, whether they're actually taking it to practice. It's a good way to actually do that. And then finally, there's one task that's on the checklist in the debriefing section that specifically asks for a readback. And the readback is just another name for closed loop communication. So the communication is on the specimen bottle, and now we're going to read it back out loud to make sure that it says everything we want to. So by probing in these three little areas, one on the checklist and two on that coaching tool, we can get a sense of how well closed loop communication is actually being practiced in our operating rooms. Speaking up. Speaking up is something that I know that we think is important, and that tool allows us to look through a specific question whether or not people are actually doing that. Team members made certain that their concerns were understood by other team members. I mean, in not very disguised language, that if somebody's worried about something, they're speaking up and they're making sure that they're heard. And this is a way, again, of teaching it and then going into your operating room and using that teamwork coaching tool to actually look and see, are people taking what I'm teaching? Are they taking what the checklist is carrying and actually putting it into practice? And here you can see that if you do the checklist the way that we've been talking about doing it together on the webinar series, up to call 17 now, it carries some of those speaking up ideas. Everyone please state your name and role, and as we've said before, it really goes to everyone please say something, and the reason for doing that is so everybody feels like they can speak up later if they actually need to, and then even more explicit on the tool then are places for people to talk about their concerns. More speaking up. So this is a place where the CRNA, when they get to their part of the checklist, they can actually express their concerns. So not only are we going to encourage people to speak up through language like cuss, but we also want to encourage them to speak up
through a tool like the checklist. So we touch on the surgeon. Most surgeons don't have problems speaking up. As a matter of fact, when we ask them if they do, they tell us that they don't. But certainly the anesthesia provider and the nursing team get their opportunity here to make sure that they get a chance to speak up, that they get some words in. And then finally, I want to talk and show you how both this teamwork coaching tool and the checklist both touch directly on teamwork. So again, 3 lines lifted from that coaching tool that deal directly with the checklist and with teamwork. Physicians were present and actively participating in patient care prior to skin incision. Well, that means the team was there, and you can't have teamwork without the team. So question 3 says, was the team there? And not only that, were they engaged with the team? Question 4 has everything to do about setting a positive tone for the operation, and we know for a fact from observations that in the first 30 seconds or minute of when the surgeon walks into the room, you can tell what kind of mood they're in and get a pretty good sense of what kind of case it's going to be at the very, very beginning of the operation. So that's very important. And again, they set the tone for the teamwork that's going to take place subsequently. And then finally, team members refer to each other by role instead of name is a backwards way of asking, did you tell everybody what your name was? Does everybody know who you are? And are they saying nurse? Are they saying anesthesia? Please do this or that. Or are they addressing people by their name, first name, or last name when they're in the operating room? We think that's really important in making a good atmosphere for teamwork. So we can take that, again, directly to the checklist and the things that are pushed forward by the checklist. Everyone state your name and role, having people have a discussion, and then finally, having the surgeon say explicitly, does anybody have any concerns? If you say something that concerns you during the case, please speak up. Now that last piece is on there to foster teamwork because it says the surgeon's now saying, I want you to be part of this, I want your mind on this, and I want to know if you think something important is going on that I don't know about. And it also directly relates to speaking up in the operating room because here the surgeon is basically encouraging or giving permission for people to speak up later in the case. So the checklist in this way is a teamwork tool. It's a tool that has speaking up built right into it. It's a tool that has communication built right into it. If you use the checklist, it will automatically lead you to teamwork. But like I said, we think that combining all this work that we've been doing together around the checklist with some focused team training can lead to even greater benefits as we go forward together. So one of the things when we talk about that tool, and I know we talked about it a little bit with the tool that's more around the checklist and checklist performance, the checklist coaching tool, we talked about who could fill it out. And what we believe, I think we all know, that it has to be somebody who's in the operating room. And the question is, for this tool, which is focused more on teamwork, who are the best people to do it and how should they do it? And this kind of walks through the techniques that we think are important in using that teamwork coaching tool. We think that, generally speaking, people from outside the room should fill out the tool. While we believe that the circulators can legitimately fill in the checklist coaching tool, for this one, the circulators are too much a part of the team, we believe, to look and assess the teamwork in the operating room adequately, and really that this should be done by somebody who's not normally in the operating room and whose only job that day is to look at the teamwork. So that can be members of the checklist implementation team, that could be nurse educators, it could be nurse managers, it could be quality improvement officers, but somebody who understands teamwork in general, who's relatively familiar with the operating room and isn't working that day in the operating room. We think in order to get a good snapshot of the teamwork in the operating room that you need to be in there watching for more than just the timeout portion of the case, the first two columns of the checklist. That it's important when you're assessing teamwork to actually watch some of the technical performance of the operation and watch the team when they're actually working together to perform surgery. And we think that at least 30 minutes is probably the minimum that you can get to get a good sense of what's going on in the operating room. Now, we also recommend that you confine or limit the number of people that you're having performed the observations. And the biggest reason to do that, so you want to have probably 2 or 3 people doing the observations in your operating rooms. And the reason you want to do that is so that the feedback that you get from them is pretty consistent. If you have 20 different people filling out the tool, probably no one is going to get terribly good at it or familiar with it enough to use it the way that it's meant to be used. So picking a group of people that are going to do this, picking a group of people who can coach off of it, we think is very, very important. Now, one of the things that we found valuable and has been done to an extent in South Carolina already by some of the hospitals who were in the first wave is to pair the two tools together. So you have one of the tools that is looking at how well the checklist is being performed, paired up in the same case with this tool, which is looking at the teamwork in that case. We think the two tools are complementary. They take some coordination then to be able to get them in the same case. And we believe that the checklist affects teamwork and teamwork affects the checklist, and we can learn more here by seeing tools that are both filled out in the same operation. So what we've suggested is that the circulating nurse complete the checklist coaching tool and an outside observer complete the teamwork coaching tool. Another way of doing this is to have 2 observers, one filling each tool out, who are totally separate from the operating room team. Obviously, that is more personnel intense, but perhaps gives you a little bit better data coming out of the checklist coaching tool. So we think that pairing them is important in the feedback that we give you and also in us understanding what's going on in your operating rooms. So people ask us, just like the other tool, what's the minimum number of these tools that we need to collect to be able to get a pretty good sense of what's going on in our operating room. And we believe that a sample of tools that's much less than 10 isn't going to be terribly helpful for you. So if you only do 1 or 2 or 3 tools, the chance that that represents your operating room broadly is actually not going to be very high. So we encourage people to fill out at least 10 of the tools, hopefully in pairs, so that we can give you feedback about what we see expressed in the tools is going on in your operating room. Now, obviously, some of the interpretation you can do, and should do yourself, but we're happy to look at the tools up here and analyze the data that you give us on the tools and then give you a report back that expresses that. So this touches on that directly. We'll give you feedback on whatever it is that you're willing to share with us. So if you send our team your tools, hopefully paired, filled out, we can give you a report back in some detail about how your hospital is doing, both along the lines of performance of the checklist and also along the lines of teamwork in your operating rooms as looked at through that teamwork coaching tool. So most of the hospitals that we've given the reports back to have found them very helpful. Just like the reports around the culture survey, this is more data that we can put back in your hands to know where you are, what kind of gaps still exist in your operating rooms, and where you might want to focus work going forward. We recommend that every hospital use this tool and the other tool to better understand the teamwork in their operating rooms and how the checklist is actually used.